Hi there, my name is Mike Brent. I'm a physiotherapist working at Complete Physio at both Angel and Swiss Cottage. I specialise in shoulder and knee rehab with a real interest in ACL surgery and ACL recovery since I had one myself. So what I wanted to talk to you now about is if you think you've had your ACL, how would you know you've had your ACL, or what would make you suspect you have had an ACL injury? So really one of the biggest things we look for with this is actually the mechanism of injury in terms of how you've done the injury. That tells us a lot. Generally, ACL injuries, surprisingly, with what most people think it's a contact injury, the vast majority are not. So most ACL injuries are non-contact. And what we look for is something we call a pivot or a shifting mechanism. So normally it's if you kind of stop and change direction, or if you have to land and you land awkwardly and the knee twists. These are the kind of things that generally cause an ACL to rupture. So if that's your mechanism already, you should always start thinking about, wow, I hope it's not my ACL. The other things we look for, often you can hear a pop when you have that injury, but it doesn't always happen. Equally, it doesn't always have to be painful. A lot of my patients, including myself, have no pain at all when they rupture ACL, but they feel something when they go down with this injury. So don't think you haven't done your ACL if you have no pain at all, because actually it's quite common. Often what we see as well is once you've had the injury and the mechanism's happened, we often find that people find it difficult to get up initially. They also find it's difficult to weight bear on the leg when they stand on it to begin with, but often that will pass after a few minutes. The other thing that we often see is quite rapid swelling in the knee. So if the knee's swollen within an hour or so of the injury, again, high likelihood that you've at least done some kind of damage within your knee. Going forward, other things people say all the time is they feel a bit uneasy with the knee. They say all the time it doesn't feel normal. People say it feels either unstable or they just don't trust their knee at all. And all these are signs that maybe you do have an ACL injury. The other couple of things we find all the time is people struggle towards the end of their range of movement. So trying to fully straighten or fully bend the knee, that can be a little tricky. And sometimes having a bit of control loss when you come downstairs is also quite typical. If you do have one or a few of these symptoms, I would really suspect an ACL injury. If you have this, please try and see either a physio or a knee consultant quite quickly, just because there are other complications you can get with an ACL injury, and the quicker we understand the diagnosis, the better we can guide you with your ongoing treatment, and the less likely you are to do any more damage to your knee in itself. If you do have any questions regarding that, please let me know. My email will be on the link underneath, or you can call Complete Physio and we can get you hooked up with an appointment.
Well, we do hope you enjoyed the video, and if you have found it useful, then please do subscribe to the Complete Physio channel and like it, and even make a comment.